Hello and welcome to another edition of Sree's Sunday New York Times Read Along. Our guest today is Chelsea Cipriano. She's the managing director of the Common Health Coalition. Our host, of course, is Sri Srinivasan. My name is Neil Parekh. We are live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. Please like, comment, share, retweet, tag your friends, do all the things you do on social media to make sure people hear about this show. In particular, I want to thank all the people watching on replay because you're probably catching this first opening segment. Thank you for taking the time to watch it. That's one of the things we like about this show is that if you're not a Sunday morning person, you don't have to watch it 8:30 a.m. Eastern time. You can watch it whenever you are available. Please let us know where you're watching from, and we will put your comments on the screen. Again, our guest is Chelsea Cipriano, and we have an exciting show for today. We'll be talking not just about the work that the Common Health Coalition is doing to take the lessons learned from COVID-19 to prepare for the next pandemic. And newsflash, everyone, COVID-19 is not done yet. It's not done with us. We're not done with it. We'll also be talking about the New York Times for Kids, the special print-only section that comes out the last Sunday of the month. We're always thrilled to take a look at it, and we're always thankful that the New York Times allows us to share the PDF on our website so that people can download it. So go ahead and do that. And then, of course, we'll be sharing some highlights from a huge show that we produced yesterday, South Asian Men for Harris. So keep an eye out for that. A few folks that are checking in so far. Patricia Freudenberg watching on YouTube under Miss You Graham. Patricia, always great to have you. Jennifer McGuire is watching on LinkedIn. Jennifer, thank you so much. She and Diane Stefani are the ones that put us in touch with Chelsea. So we're so thrilled to have you watching. Jonathan is watching, saying greetings from the East Village. And Sujana is watching, saying good morning. We have got to stop meeting every day like this. She was on watching yesterday's show. And as a good reminder, we're live on my Twitter account if you're looking on Twitter. So retweet that post if you can. I'll go ahead and bring on our host, Sri Srinivasan. Sri, we've got to stop meeting like this.
Dr. Sujana put it so well. We spent 3 hours yesterday together, and she was watching amazing doctor who helped us understand the pandemic in so many ways as a guest on this show multiple times. And then we produced her show with her best friend from high school, Dr. Marina Kurian. The two of them put together She's on Call, a show that took phone calls and questions from the audience throughout the pandemic. More than a year's worth. It was an amazing experience. So thank you, Sujana, for being a great supporter of everything we do. So what we did do yesterday was to follow in the footsteps of our Black and South Asian sisters. I'm sure you heard about Black Women for Harris that had 44,000 attendees. And then immediately after that, there was South Asian Women for Harris, 10,000 attendees. And then there was White Women for Harris that had 100,000 attendees and broke all those records. And in the meantime, we put together South Asian Men for Harris. This was a project that came about in 75 hours from idea to execution. And we were so grateful for the enormous response and interest. We had some great speakers. We'll quickly show you who was there. We launched with Salman Rushdie, who we learned I was mispronouncing his name all this time. It is Rushdie, and he made a point to correct me. So now you all know that we've been all saying it wrong. Salman Rushdie is what he would like us to say.
But Sri, I will say he did correct us on the pronunciation, but he couldn't have been a nicer guy. He was very humble. We were all starstruck. We did take a picture before the show started. All of us were tongue-tied. Maybe not Sri, but the rest of us were just didn't know what to say in front of such an incredible person. And he was not, he was completely not having it. Call me Salman, just very laid back. It was great. It really was incredible.
Yes, so he was great, and I've been honored to know him for a long, long time. Manu Bhagwan was our co-host and the inspiration for this idea. You see Harini Krishnan, who is co-founder of South Asians for Harris, and then Devin Parekh, who happens to be Neil's first cousin, was booked by someone else for our show. He is a long-time venture capitalist as well as a long-time Democratic donor. This was just one set of our 30 speakers. Let's quickly just show you some of the others who were there. We had a whole bunch of elected folks, including Jay Chaudhary from North Carolina, Arvind Venkat from Pennsylvania, Neil Makija from Pennsylvania, and New York City Council member Shekhar Krishnan. And then we had another set of great folks who are friends of this show, including Walter Greason, who is a professor of history, art, and economics, as well as one of the people who helped design Wakanda for the movie, and Gautam Raghavan, who was an advisor to both President Obama and then Vice President Biden, and Raj Goyal, who was quoted on the front page of the New York Times about Kamala Harris because he's a long-time Democratic fundraiser. Who else? I don't know if we have any more of the screens. Yeah, very quickly, Wajahat Ali writes a great Substack called The Left Hook and runs the Democracy-ish podcast. Anurima Bhargava was co-founder of South Asian Women for Harris. Rajan Shah, long-time political fundraiser who put together the South Asian Bloc Party for both Obama and Biden. And Rahul Bhavnani, also a long-time politician, political fundraiser and supporter, and Salil Tripathi, who is a great writer and author, talking a lot about the international aspects of what's at play here. And finally, you see Ruhi Rustam. Ruhi is the national organizing director of the Harris for President campaign, not the South Asians for Harris campaign, but the main campaign. Mahan Gunaratna is comms director for New Jersey Governor Phil Murphy, and we had Neha Devan of South Asians for Harris. Samir Patil, who is the co-founder of Scroll Global, the independent news site from India, and Nick Rathod, who has been in politics for a long time. People kept calling him the OG Neil. He, among other things, he ran Beto O'Rourke's campaign for governor. So this was just a taste of the folks who were there. We didn't even show you two of our congressmen who were there, Raja Krishnamurthy and Ro Khanna, and we ended with an amazing pitch from the the mayor of Cincinnati, who happens to be half Punjabi, half Tibetan. And that was all came together 75 hours from idea to execution. And Neil was there every step of the way. He's the first person I called when this came together. And I don't think he slept those 75 hours as we went live. So this is part of what we do at Digimentors. And we produce shows like this. If you would like a show, please let us know. We also do PR, marketing, comms, training, including AI training, AI policy, strategy, scenario planning. And if you have an event, we'll come help blow it up, make it seen by many, many more people. And we want to thank our sponsor, Muck Rack, for being with us for so many years at the Read Along. And if you'd like to be a sponsor, please write to us, Sri@digimentors.group and Neil@digimentors.group. And we also produce a show that Neil's involved in, and that's a show called Shining Light on Shadows, a candid conversation about mental health. They just did a show in the middle of all of this. He did his own show with Don Helmer Newberg. They host the show together, and episode 11 was Samantha Collier, Surviving and Thriving After Rape and Sexual Abuse. Very powerful episode, just as all of his episodes are, their episodes are. And I encourage you to check that out on his social media. And we have an episode coming up on August 1st Reverend Tyler Coles. Getting help takes a lot of work and some courage. I think it takes a lot of courage. So Neil himself has spoken out about his occasional issues around mental health. And I want to thank you, Neil, for being a South Asian man who is willing to speak up on so many important issues, including on mental health.
Thank you. Thank you so much, Sri. We are going to focus this next episode. We usually go 2 weeks, second and fourth Thursdays, but we'll do a special episode this coming Thursday, focusing on getting help, on actually getting therapy. It's not easy to even start that process, and so Tyler and I will talk about our experiences with that. So we appreciate all of your support, and please do tune in.
Yeah,
But today,
so much going on. Let's look at who's here. Apollo's watching from Philadelphia. Paula Kiger, longtime producer of this show, is watching from Tallahassee. Hi, Paula. And Patty's watching from New York, and she's watching on both YouTube and on Facebook. And that's the show, folks. We're live on Facebook, Twitter, YouTube, LinkedIn, and Instagram, as well as the Digimentors website. And this week, as always, we want you to go to the website, but Neil, let's show them why they should go to the website.
Absolutely.
Because you go to digimentors.group, look for the New York Times read along button, and there you will find the episode for today, and you will get world exclusive a PDF version of New York Times for Kids. It is not available on the internet. It's not available anywhere. Only on this, thanks to the New York Times, only on our website, and only till noon Eastern time. So please go in there. If you have children, I would say between 7 and 14 or so roughly, you want to get the PDF of this if you're not a subscriber. So it's only available to print subscribers in the US. So you want to download this and get a free copy. Send it around to your friends, your children's friends, etc. The New York Times for Kids. It is a fantastic reason to tune into the show. We will take a look at that. And we have so many great people watching. Ken Fisher says, good morning, not from Grant Wood Studio in Cedar Rapids, Iowa. And Deborah is watching from DC, where things are exciting and in flux. And Patty says, congrats on the South Asian Men for Harris production. And by the way, we had women and allies there as well, watching from Cheshire, Connecticut. Everyone who's watching, tell us where you're watching from and tag a friend. They can watch us live or later on any of these channels. And I know that our guest Chelsea is right now furiously tagging, sharing with her friends so that they can join her in just a couple of minutes. Miriam Berkeley is watching from Hell's Kitchen. And we are just so happy to have Neil's mom watching, as she always does, our #1 fan, Hastings on Hudson. And lots of great comments coming in. Pradnya watching from Rehoboth, Delaware, here for a mini break with the kids and your birthday, I believe. And I heard about it on the internet, so it must be true. And Lancaster, Pennsylvania is Linda Lawrence. So thank you all for being here. Before we bring in Chelsea, we'll just tell you what we do. We read the paper with our guest after talking to the guest for a bit and understanding their story and what they're working on. And then they'll help us read the paper together. Let's just look at what's on the front page of the Times. The Secret Service strains to keep presidents safe. And Vance and the undoing of an old friendship. Emails reveal a bond ruptured by politics. And then over here, lobbyists greet Harris campaign. Cutting politics to sell movies to the masses. And in West Bank, residents cling to livelihoods. To Biles, just only judge who matters is the Mirror. And I just got a breaking news alert, Neil, that she landed one of the toughest moves, or maybe the toughest move on the vault. I just saw that. I didn't get to read everything about it, but that's so exciting. The Olympics are going on, but because I've been so caught up in our regular work as well as the project we did for South Asian Men for Harris, I didn't even register that the Olympics were starting on Friday. And so I've not seen a single moment or even anything with the Olympics opening ceremony, which is very unusual for me. Going back decades now, I have not missed it. Did you catch anything, Neil?
We are interested. I set YouTube to tape all the swimming events, because as you may know, Emily is on the swim team. She did finish first place in 2 of her heats this year.
Woo!
So proud of her. But if you, as a spoiler alert, when you look at the sports section today, they have a whole thing on the Olympics that we'll get to. Maybe we'll spend a little bit more time on sports today than we usually do.
Sure.
But you're right.
Yeah.
The Olympics are here.
Yep. And I will say one more thing about the election, with everything going on, that the New York Times has yet another story about Usha Vance. She's adjusting to life as a prominent political spouse, leaving the fast track to focus on family. All very nice stuff here. At least when we read it, I will know more. But the Washington Post headline and its story is about Usha Vance being someone who disliked and criticized Trump multiple times and now is working to elect him. So how newspapers frame things matter. And here you'll think, oh, she's just someone who is just another political spouse. She's not. She is full MAGA now. She wasn't before. And someone said, oh, she's drunk the Kool-Aid. No, she's in the kitchen mixing the Kool-Aid and standing by her husband in this very way that is surprising to so many people who knew her back in her days in law school. So with that, let's talk about what we're here for today. We're trying to understand what we learned, lessons from the pandemic, and where we go from here. And we have a fantastic guest for that. Chelsea Cipriano is here. She's on LinkedIn, Chelsea Cipriano. Connect with her. Follow her there. She's managing director of the Common Health Coalition, using the lessons of COVID-19 to prepare for the next pandemic. I don't think, apart from the politics and the election today, there is anything that we should be paying more attention to than how we prepare for the next pandemic. So I'm very excited to have Chelsea with us.
Hey,
Hello.
Chelsea.
Hi, thank you so much for having me.
Thank you for being here, and thank you for being patient as we went through some of the things that we're doing, and we're delighted to have you here. We want to hear from you about your career as well as the work you're doing at the Common Health Coalition, and then we want to get your take on the news as someone who works in the public eye. I know you have to be careful about politics and the things that you're allowed to say, because I know that there are rules about these things, but we will address what is going to happen the next time, because, by the way, there will be a next time for sure, as we know, and we can hope it'll be 100 years the way it was between 1918 and 2020, but we don't know if that's the case, and we highly doubt it. So let's start by asking the question I usually ask, not about your work, but are you a Sunday morning person?
Thank you. Yes, I'm a morning person every morning, but on Sundays I like to get up and get the ball rolling so that I don't feel like I'm just kind of racing into the week. But I know that is not a popular opinion, including in my own home. So I am the only Sunday morning person in my house.
I notice you're not having to whisper though, so that means you have some distance from.
Yes, I am in a cube of silence right now in a separate place. We're having some Wi-Fi issues. We can get into climate and the ever-changing weather systems later, but there were some storms here that destabilized Wi-Fi. So I'm in a nice quiet space. I don't need to worry about waking anyone up today.
All right. Being camera ready at 8:30 or earlier on a Sunday is a special thing, and we appreciate your doing that for us and for the cause you believe in. So tell us about the Common Health Coalition.
Yeah, sure. Absolutely. I think if I can start with a little bit of who I am to lead into the coalition, that might be helpful, if that's okay. So I like to say I'm a public health human, as a trained public health person, but also in my daily life, I kind of live in this intersection between healthcare and public health, and always have. I'm an EMT by training. I am married to an ED and ICU doc, and I'm the daughter of a public health official. So I've kind of always lived in this space. And that's really when I came to the coalition from many, many years in public health government. And I was approached about the coalition by its chair, Dr. Dave Choksi, former health commissioner of New York City, I was all in because this is the space that I've always lived in, and maybe not one that the general public even knows exists, but is one that's so important, that's happening in the background every day. Healthcare and public health working, maybe not always so well together, but always happening in the background. So the Common Health Coalition was born out of this idea from 5 leading healthcare organizations: the American Hospital Association, the American Medical Association, the Alliance for Community Health Plans, AHIP, so formerly America's Health Insurance Plans, and then Kaiser Permanente, coming together to say, we need to do something better with public health, hand in hand with public health, because we learned a lot of lessons from the COVID-19 pandemic. There was immense loss of life, of livelihood, and I think we all experienced that regardless of where we were sitting for the pandemic. I was sitting in a response role in New York City, in part of the leadership team for New York City. But regardless of where you were, you know that it was awful and heart-wrenching. But what a lot of folks may not know is that a lot of innovation came out of the pandemic in terms of better sharing information between healthcare and the public health systems, and community-based partners and businesses. And we don't want to lose that innovation ahead of the next pandemic or the everyday crises that we face, like mental health, overdose, loneliness, diabetes, the other health crises that are taxing our communities and our friends and family every day. So we are taking we can do better. We can learn, not just lessons learned, but lessons mobilized from the pandemic. And so we started with these 5 members. These are our 5 founding members. And now, just in 4 months, we've grown to about 60 members, and we're still growing. So I think that's a real testament to the appetite for the industry and the health system at large to come together and say, we need to change, and we need to do better for the people that we serve. And we do that through healthcare and public health partnership. So that's what we're doing. Happy to talk more about it, but really grateful to be here today.
Thank you for what you're doing. Tell us about how common it is for this range of folks to come together on anything, because we see there are insurance companies, then there are hospitals, big pharma. Like, how is all that connected, and what is the history of them working together?
Yeah, thanks. It's, the answer is it's not common. As cheesy as it may sound, we say we're the Common Health Coalition because of this common goal of improved health, saving lives, improving health. But we're doing things in a pretty uncommon way. We are bringing folks together who are not typically, working together all in on the same issues. And they are all at the table saying we all have a role to play in this, and we're all here to try to make progress and improve health. We're also taking a bit of an uncommon approach in that we're not trying to just issue recommendations. There are many recommendations out there. I think they're extremely valuable, building the evidence base, as we call it in public health, and trying to frame what we need to do in the future. We're focused on action. So this isn't going to be like another report. We are issuing commitments, and I'll talk a little bit about those in a moment. Our framework for this is, everything needs an acronym. So it's called CARE. And I think we have an image for that. So thank you so much, Neil. The CARE acronym, I think, is helpful to kind of make this real, right? Again, most people who interact with the healthcare system aren't worried about this stuff happening in the background, but it's important. It is important that it is happening, that this partnership is in place. So CARE, so C is coordination between healthcare and public health. What does that mean? It means that in a crisis or day to day, there are plans in place and relationships in place where your local health department is talking to your local hospital and saying, this is what's happening. This is what we're seeing on the ground. Can we share resources? Can we share staff? And folks may assume that's already happening. In many places it is, in some places not so much. So we're trying to help foster those relationships and really solidify it so that it's not a bunch of people sitting around a table with lawyers during a crisis. It's done ahead of time. Always on emergency preparedness. Kind of self-explanatory, but how do we standardize emergency plans and make sure folks are reading from the same sheet of music and not 18 different sheets of music so that it doesn't sound like a symphony, it sounds like noise? Real-time disease detection. So this is about how do you get, if you see a case of measles in a hospital, in an ED, right? My husband's an ED doc, a critical care doc. Many of your listeners are probably clinicians. How do you get that information to the health department to signal what could potentially be an outbreak? Right. And so linking 3 measles cases is how you identify an outbreak of measles. And so the speed with which you can do that really determines how fast you can respond to an outbreak, which we know is so critical for schools and communities and et cetera, et cetera. And then E, exchange of data to advance health equity. This is super self-explanatory, I think, but essentially we saw during the COVID-19 pandemic, the rapid and secure exchange of data in a way that we had never seen before. We saw dashboards going up on public websites, helping community members know what was happening in their own communities. So when you walked out the door in the morning, you weren't wondering, I wonder what's happening here today. You knew that your neighborhood or state or city was in a hot spot or experiencing a surge, and you knew the precautions that you had to take, or ideally you did. And I know that wasn't consistent across the US. So this is our framework. We're trying to build this. We know these activities are happening out there, right? We know governments and also hospitals and all of these organizations are already doing these things. How do we identify them, give them a spotlight, and help replicate that across the country so that we truly are in a ready posture for whatever the next thing is and day to day?
Wow, that is such important work, and I'm so glad to learn about it. And I think everyone should go out and check the Common Coalition Common Health Coalition.
Common Health Coalition, yes. And
.org.
I should have, I'm sure my PR folks are screaming in the background. We are open if you want to join, if you are an organization, individuals, we haven't reached that point yet, but if you're an organization head in healthcare or public health and you want to join, it's free. We are making a low barrier to entry. You just have to commit to one of our commitments to doing that in the next 1 to 2 years. And we want you on board. We want this to be a big tent of diverse, geographically diverse folks who are into this work and want to help us make a difference.
We are very proud to have worked with Hip Hop Public Health, an amazing organization based here in New York.
They're incredible.
They use hip hop music to help Black and Brown communities improve their own public health. And they did this long before the pandemic. It sounds like a pandemic project, but it's not. And so everyone should check out Hip Hop Public Health. And we will be sure to mention your work to them if you haven't connected already. Awesome. And we want to say hi to everyone who's watching, including Ron Thomas watching from Verona, New Jersey. Ron, I have to see you before you go back to Dubai. And Miriam says, so important to look ahead. Patty loves your acronym CARE.
Thanks,
and do you work with nonprofit organizations like Rotary and others?
We haven't yet. I should have said this organization is really new. So we are less than a year old. I'm in our formal capacity. We just announced like the membership, please join us in March. So we are new and we are hitting the ground running. That's kind of the uncommon approach, is we're just like, there's no time to lose here. So if you know or are connected to an organization that you think should be in this, party with us, please send them my way. We are happy to have as many folks on board as possible, including great point about community-based organizations, particularly those serving Black and Brown communities and underrepresented communities. A huge focus of this work is equity. And the only way that we actually achieve health equity is to bake it in from the beginning. This is not, you don't bake a cake and then sprinkle flour on top. Equity is like that. You need to bake it from the beginning. And so I think that we're really looking to engage community organizations that have been doing this work for years, to your point about hip hop public health. This is not just about the pandemic. That was kind of like the impetus and the movement for this, but organizations have been doing this work long before this. We're just here to rally them and amplify them.
So that's an important point. If you look at your partners, they're all such huge organizations because they're like coalitions of other organizations that it might be daunting for an executive director or someone from a smaller nonprofit or community organization. So I'm glad that you're open to this. So they should find you. Is there a form online, or should they reach out to you on LinkedIn? What's the best way for anybody watching in the This is a U.S. project, right?
U.S. project.
So where can what's the best way for them to approach you and talk
Yeah.
about possibly joining. You said there's no charge for joining the coalition.
Nope, no charge. So you can email info@commonhealthcoalition.org. Or if it's easier, our website has a direct form. So if you go to commonhealthcoalition.org, on the website, there's a join us link, and there's all information that you could possibly want, including joining our newsletter, emailing us, and signing up if that's of interest. And, you have your organization's approval, or if you are an executive director. Exactly. We want the smaller organizations. I think the rare role that we can play, the uncommon role that we can play, is being able to bring those voices into the same room as these massive organizations, right? I think it's a really rare occurrence that folks can sit at the table together in ways that they never have before. And that's the key, right? That partnership between healthcare and public health, but also with our community partners, nonprofits, et cetera, is the key to being ready next time. It's not scrambling and trying to do it in real time.
Doug Levy, who is in public health, he's a great public health communicator. He wrote a book about how for emergency responders should be dealing with healthcare communications and other communications. Is awake early in San Francisco, as he always is in the Bay Area. So thank you, Doug. And he says such important work. Earlier, we saw that Neil's mom was watching, and Pradnya says Neil is lucky to have such a supportive mom. He absolutely is. We're seeing great comments coming in, and look at what Pradnya is doing. She's tagging people in LinkedIn who should know about this. So if you know anyone who works in public health who may not have heard yet about the Common Health Coalition, here's your chance. It's a new organization, so they may not have crossed paths yet. So tell them about this. And Miriam says, so important to look ahead. And I completely agree about that. And look at Pradnya. She's just tagging. And Patty, who represents the Rotary folks, she says that Rotary has a seat at the UN and also helped eradicate polio. So you'll never know where those connections come from and what can happen. And we see there's a form. We actually have a little video that we'd like to play that tells us more about the work, and then we'll get to the paper after that. And if you have any questions about the pandemic, this is the time to ask. She's not a physician, but she can talk about the public health aspects of this because, by the way, as we know, COVID's going around. There are so many people who are having COVID now. It's not over, but it's still here, but it's what we're calling endemic instead of a pandemic. And maybe you can explain some of those concepts after this video.
Yeah.
Here's a secret you might not know. Healthcare and public health are two critical pieces of America's health system that, believe it or not, haven't always worked consistently together. But during the height of the COVID-19 pandemic, saving lives meant having to work hand in hand. In many places across the country, the arbitrary walls that kept the two fields divided disappeared seemingly overnight. This unified, de-siloed health system should be our new normal. Instead, we are seeing the opposite. Walls are being rebuilt and life-saving innovations left behind. There is a future in which those hard-learned lessons from the pandemic aren't forgotten, but instead are identified, amplified, and replicated across the country. That's why we created the Common Health Coalition. 5 leading American healthcare organizations have banded together under one banner for the first time with a clear purpose: to pursue a reimagined health system, one in which public health and healthcare work hand in hand to save lives and prevent suffering. A common goal, an uncommon approach. Join us at commonhealthcoalition.org.
Nice. That's our guest, Chelsea Cipriano, and she's the managing director of the Common Health Coalition. Thank you for sharing that video with us. And I love that idea of a common goal, but an uncommon approach. I did mention Big Pharma, but they're not actually in the 5-person coalition right now. What is their role in all of this?
Yeah, no, I think that's something that we are open to and exploring. And as we grow, I think having pharma, but also pharmacists at the table as really providers who not stepped up, they've always stepped up, but, an immense number of people in this country get their primary care now through pharmacists in their local pharmacies and vaccines. And so I think bringing pharmacists to the table is really important. So we're growing. It's not just physicians. We're bringing in nurses, community health workers. That's another group that was so vital during the pandemic, but long before. So I think this is just the beginning. And so if you are a pharmacist or work for a pharmacy organization or pharma, please, get in touch. We are welcoming with open arms.
And you also, what about groups of nurses and other folks?
Yep. Same. We have been working with nursing organizations across the spectrum of nurses and other, paraprofessionals, like I said, like community health workers. We have to engage PAs. I think they're, of course, a critical part of primary care. Physician's assistants. I'm sorry. Yes. And others. I think that there is a broad spectrum of workers along the health system. And I think more and more that we talk about it as the health system, not the healthcare system or the public health system, but a health system where we're breaking down those silos, breaking down the barriers, and figuring out how we can work together across all these professions to really amplify each other's work, but also fill the gaps where we're seeing a ton of burnout across all of these professions, right? Mental health and otherwise. And how do we address those if we're not working together? We can't. So that's what we're doing.
Thank you. Debbie says, let all the public health schools and alumni know about this. So everyone, even if you don't know people at these big organizations, maybe you have your alumni office from your public health school. They should definitely know. And Sujana Chandrasekhar, Dr. Chandrasekhar says this current type of COVID-19 is hitting people pretty hard. And people are being really thoughtless. They're coming in for routine care still. She's an ENT surgeon and people still showing up. And one of the things that I was surprised to learn that is in most parts of Scandinavia, they don't even carry tests anymore.
Wow.
It's just routine. So like, you have it's like having the flu. You don't need to know exactly what flu you have. It doesn't matter. They don't even have Paxlovid and other things that we have here. I'm not saying everywhere in Scandinavia, but the people I'm talking to, some of the folks who watch know that I'm co-hosting this year again, the Nobel Peace Conference in September.
Wow.
And I'll be in Oslo for it. And the way they approach public health is so different here. You have a master's in public health and in international development and all of that kind of international health tied together. So I think that's really important. Dr. Sujana, thank you for your comment. She says, positive active disease, no mask, no notification, meaning that's how people are showing up because they just don't think it's a problem. And Neil's reminding everyone to thank you for watching and for commenting, and tag a friend right now, folks. They can watch live or later. And we have folks who are also replying and commenting on Twitter. And I've been, by the way, locked out from Twitter partly because of Mr. Musk's my criticisms of him. But during COVID, I came across a study from the 70s. Loneliness causes disease. How does this play out? And could this also have added to the death count?
Wow. Yeah, I think so. First, I just want to amplify what you're saying, Sri. And then I think the notion that COVID is over is one that we do have to fight every day. I think folks want it to be over. I think that there is a collective pandemic amnesia creeping in, and that makes this work really hard to do. Number one, on like a systems space, but also just on an individual patient care space. I'm not a doctor, but I am married to a doctor and also have worked in government public health for a long time. I worked at the CDC, at HHS, at New York City Department of Health and Mental Hygiene during the pandemic. And so it has been my role to want to be a voice of truth, of science, and of clear guidance that folks can use when they need help. Right. And so that includes guidance about what to do, how to prevent COVID-19. And it's hard because the spotlight is fading. It is still with us. Folks should still be, first and foremost, if you feel sick, stay home. Stay home. And if you can't stay home, wear a mask. And if you look at the CDC guidance or your local health department's guidance, hopefully it's up there that you can find your local guidance about where to get Paxlovid if you're eligible, if you test positive. Paxlovid is an incredible tool. And then also, of course, staying up to date on vaccines. We should see updated guidance from CDC very soon on the updated COVID vaccines for adults and for kids, particularly populations who are more at risk for getting severe illness. But we have to think about not just ourselves, but also our community around us. Answering the loneliness question, I think our Surgeon General has been doing some fantastic work across the country on loneliness. If you haven't seen it, please check it out. Dr. Murthy's real loneliness tour really across the country. I had the pleasure of hearing him speak at the Aspen Institute Health Conference this year. And he spoke, something that really stuck with me. He talked about the impact of loneliness on physical health and how it's hard to spot and how everyone's definitions of loneliness may differ. So they may not know, right? You could be surrounded by people, but still be lonely. And that impact on physical health. But also one thing that he said that I think will probably resonate with a lot of folks on this stream is he's been touring universities. And I think all of us who were attended university or know folks who have or visited one know that the lunchroom is the cafeteria, right? Student union, or is like the craziest place on campus. Lots of noise, everyone talking. And he said on his tour, what he has seen is that those rooms are now silent. And everyone is in their phone or on their computer. And that just really hit me hard. I'm a former university student body president. There's just something about that made me very sad that today's university students are surrounded by people, but perhaps still feeling very lonely in those settings and beyond. So yes, I thank you. I don't know who brought that up, but whoever said that comment on X,
Anita Joe, thank you, Anita.
Spot on. Mm-hmm.
Yeah. Speaking of Vivek Murthy, here's a photo of him with my twins when they were much younger in 2015 at the India Abroad Person of the Year ceremony. And that's Nina Davaluri, former Miss America, Miss USA, I'm sorry. And she is a wonderful community leader and activist now. And Vivek has been talking about so many things, not just the loneliness, but also about social media. And that's those who are connected. Yep. And that's part of the problem that we're facing. Patty asked a question: Do you have telehealth movements involved in this?
That's a great question, Patty. Not formally as telehealth only. I think all of the health systems that we work with really embraced telehealth during the pandemic. That's one of those innovations that I like to talk about, is seemingly overnight after, lots of, we can't do this, it's too hard. Telehealth was the way that so many Americans were receiving healthcare. We figured it out, right? In times of urgency and crisis, we get creative. So how do we create that sense of urgency, not during the time of crisis, but before? I think telehealth is one of those amazing innovations. And so, I welcome you. If you have a connection to telehealth organizations or others who should be involved in this, please send them our way. We mostly are talking about telehealth in the context of the health systems and hospitals that are our members. Thank you.
Since we mentioned my newsletter, that's where I wrote about this. I want to just remind folks that you can find my newsletter on Substack, srinet.substack.com, and would love you to join us. It's a free newsletter. I write, as you can see, about politics, but I love this quote. I don't know if you've ever seen it. This is a letter John Adams wrote to Thomas Jefferson before either of them became president, where they were trying to decide, do we become a republic or do we support the kind of they're going to get rid of the king, obviously, but they were thinking about what comes next. Wow. And John Adams says, "My dear sir, I look at elections with terror." And it's a wonderful line from a book by Jill Lepore, the Harvard historian, that I recommend to everybody. It's a 1-volume history of the United States called These Truths. And it is eye-opening, even for someone who is a history major and who thinks he knows a lot about history. I learned a lot from that. And among other things, the impact the Supreme Court is now having on public health in so many ways, right, Chelsea, that they had almost no power when they were born. When the Supreme Court was born, right, they didn't even have a building. They had nothing. It wasn't even intended to be lifetime appointments. So it was just a very different time. And when we think now, that time was different, but in today's politics, a lot of people want to go back to that time and presume that these founders of this great country were all perfect human beings. Mm-hmm. And when you read this book, you find out that they were not, or that's reinforced in so many ways. So I recommend that book, and I would love for you all to check out my newsletter, srinet.substack.com. And if you aren't interested in my social media tips or my look at politics, our friend Bob Anthony writes a tech column in it every week. So you get something very practical in addition to some of my random musings. But Bob is great, and you want to read his tech tips. So srinet.substack.com. Let's see lots of comments and people watching. Folks, that's Chelsea Cipriano. I'm Sri Srinivasan. This is the Sunday New York Times Read Along. We'll be reading the paper in just a few minutes. I have to ask the pronunciation. I would have said Cipriano because of Cipriani's, the famous restaurants and event spaces in New York. So tell us the history of your name.
Oh, that's a great question. And I'm sure that there are ancestors rolling over in their graves right now that I am not using the authentic Cipriano. We can start now. I mean, it's never too late, right? I think my parents may be watching, and so I'm sure they're chuckling to themselves. But yeah, it is Italian. I am Italian American, among other things. The other half of my family is English. They came over and helped found Salem, Massachusetts, actually. So that's the other half.
Wow.
Yeah, but Italian, Northern Italian. But yeah, Cipriano and Cipriani's, there's probably some relation there. We'll blame an Ellis Island situation, probably.
It was very hard for me to say Cipriano, being married to someone who's half Italian herself. And we joked about it when I first met Chelsea. But
I know, yeah.
Sip, as in take a sip of water. Cipriano.
Sip of water. That's how exactly.
Yeah, that's great.
And it's Sri, not Shri, right? It's an SREE.
Sri.
I take anything. I'm just glad. I used to always say it like at in coffee houses or whatever, when they asked your name, I would say like tree with an S, and then they would write down trees.
Yes.
They would hear that. So names are fun. And
I'll just share my name, because I deal with this as well. Parekh. I had to leave messages for family members. I remember this a couple of years ago. I called my mom, my uncle, I think my dad was still alive, a cousin. Everybody pronounced their name just a little bit differently on their voicemail. So there's no consistency anywhere.
What is this voicemail you speak of?
Voicemail, yeah, exactly. That's when we used to leave voicemails.
What is it? Yeah.
No, and voicemail was so important. By the way, Chelsea, when I would go to India, I would try to bring the idea of voicemail to the workshops I would do. And people say, why do you need voicemail? I'd say, well, you want to leave a message so they'll know you called. And they would say, no, you leave a missed call. That's how you know that you called. You don't need to say why you're calling, all of that.
Sure.
So, and now I can't remember the last time I left a voicemail. What I'll do is I call. If I get voicemail, I will not leave a message, and I'll text them saying, didn't leave your voicemail.
Totally. I'm very into the voice notes now. My Gen Z colleagues really turned me on to leaving the voice notes, but I have to say I still leave them as if I'm leaving a voicemail. So
I'm not even sure what the etiquette is of those anymore, but let's
please don't leave me a voice note. It takes more effort. Just type it out. I'll read it. Because then I have to press play if I'm with someone. I mean, it's just no voice notes.
Or just transcribe it or dictate it, and then it'll
dictate it. Yeah.
You can do all kinds of things. Sujana saying, Sujana's tagging the NYU School of Medicine and the people in the PA programs there. I get both spellings, odd spellings as well as mispronunciations. It can be amusing. Well, Jonathan Borstein has had me. I mean, I was mispronouncing his name every day for during the pandemic. Chelsea, we did a show called Three's COVID Show. We did it 300 straight episodes every single day.
Amazing.
Weekends and everything else. And he would always tune in. He would always be the first to watch. And I was saying Borstein, and then Neil. Now I'm confused completely. So remind me what the correct pronunciation is.
I was going to say, Sri, is that we had him as a guest on the show. We figured out the way to pronounce it. I think it's Borstein, as in like I can't remember now. But I will tell you that I've stopped saying his last name. when I welcome on the show, welcome on Jonathan, I just say, welcome, Jonathan. We're glad you're watching. Help us out. It's like beer Stein, but it has 2 O's instead of 2 E's. So beer Stein.
Okay. No,
So
Borstein.
Yeah, but Stein. So
Yeah,
Borstein.
okay, there we go.
Oh my God.
And Naomi says, my kids insist I text in order to make a planned phone call. Busy lives, I suppose. Our kids are a little bit like that, but I will, my late mother would call them day or night without an appointment. And because it was Granny, they would take the call and she would be on video call right away, which is really dangerous. But she would like be on the call like this with them and they would answer. We have to make an appointment in order to be able to talk to them. And Jonathan says, don't worry, the first name is fine.
While I'm here, Sri, I just want to give a shout out to folks watching on Instagram. We can't bring Instagram comments onto the screen, but we have a number of people watching, in particular, Deborah Kerr said that she'd been traveling for 3 weeks in and out of restaurants and hotels and can say that what's notable is a lack of COVID protocols. It's no wonder COVID has reared its ugly head. So take precautions. Like I said, a number of other people have been watching. I want to thank everyone watching on all our channels on Facebook, Twitter, LinkedIn, YouTube, Instagram, and our Digimentors website. We're going to be switching to the paper now, talking about the New York Times for Kids. But if you missed the beginning, if you joined us late, when we're done, this show will be available on those same channels just a few minutes after we're done, so you can watch from the beginning. It'll take a little longer to put it on Instagram, but it will be online very soon. And Sri is trying to show the New York Times page here. You're trying to show the New York Times for Kids.
Yeah, and it's free to download, world exclusive till noon Eastern time. So if you're watching live, if you're watching afterwards, you will miss it. But if you're watching live till noon Eastern, you can download a PDF of New York Times for Kids. And if you have kids in your lives, and if you don't have your own children, if you have kids between 8 and 14, your neighbors, your nieces, nephews, grandchildren, whatever, you want to get this, keep it for them, the PDF, and then send it around the schools, etc. This is by special arrangement with our friends at the New York Times for Kids section. So please go to digimentors.group and then look for the New York Times Read Along and look for the Chelsea episode. And it'll be in the Chelsea episode, so you'll find it there. And look at Pradnya still tagging away. Everybody, please do this on the platforms so we can all learn about the Common Health Coalition.
Special thank you on the New York Times for Kids to Tom Jolly, Wayne Camadoy. Tom Jolly is the print editor. Wayne Camadoy is the art director. And Amber Williams, who's the editor for the New York Times for Kids, former guest on our show.
All three.
All three of them. And they have given us this special treat to share the PDF. Make sure you download it because I will be taking the link down afternoon today.
Mary points out that at least our names are not being mispronounced on purpose, like they are with Kamala Harris to make her sound different. They're othering her. There's another way of othering her. And by the way, I mentioned Elon Musk and his team have sort of blocked me off Twitter. And one of the things he did overnight, I don't know if everyone saw this, but he shared a doctored audio of a cloned video audio in a video form of the vice president saying she is a DEI hire and all this horrible stuff that is just not true. And it was a fake audio clip, and he shared it to his hundreds of millions of followers. And this is a man who claims that he is a centrist and it's the world that has changed around him, and just total liar, as we know. All right, let's keep going. Pradnya says, many years spent fundraising in academic medicine. I know many amazing people who should know about this. So thank you, Pradnya. You are a great friend of the show, and you've been on the show. We really appreciate it. If you'd like to be, first of all, a speaker on the show in the future, we're booking into October. We need guests every week. We need great guests every week. So nominate yourself or a friend by writing to Neil at digimentors.group, but also write to him and he'll add you to our mailing list. You'll get maximum one message a week that tells you what our upcoming show is. So please sign up for that by writing to Neil at digimentors.group. You will, because we're all so busy, we can't keep up with this stuff. At least you will know. All right. Anything before we move to the paper from you, Chelsea?
Yeah, I think just two closing thoughts. One is that I first of all, thank you so much for having me. I know we'll dive into the paper next, but I do want to plug, we recently sponsored an issue of New England Journal of Medicine Catalyst, and we have a link on the Coalition's website and LinkedIn that makes the entire issue free to folks. And so I know that you all share our vision for, getting information, accurate information and clear communication out there publicly. And so this is free of charge. We have the entire issue. If you've ever wanted to dive in free behind been stuck behind a paywall, we have the whole issue for you. It's actually a special issue on healthcare and public health innovation. So it sounds like from the comments, we have lots of interest in this space. And so please go check it out. It's free. So enjoy. I know there are a lot of public health and healthcare nerds on here with us. So glad to have you. And then too, just plugging the Coalition website again, commonhealthcoalition.org. Check us out. Shoot us an email. Let us know if you want to get involved or have an organization that wants to get involved. We're happy to have you and happy to have these connections. So thank you. Thanks, Sri, for this platform.
Thank you. And you're not going anywhere. We're going to be together for the next half hour reading the paper, and you're going to jump in as you can. Tell us about the how this is supported. Are you raising money from organizations, individuals, et cetera?
Yeah, no, not individuals. Right now, our first year of funding was provided by Kaiser Permanente. And so in future years, we are actively fundraising and recruiting organizations to support. But our goal and vision was to make membership free of charge so that there isn't a blockade for smaller organizations to join. So I just want to make sure that's super clear. But yeah, not individual donors, organizational sponsors coming on board.
You're a 501c3?
We are not for profit. We serve under a fiscal sponsor. So we are.
Eventually, is that the plan?
Exactly. Yep. Like I said, still new, but we're incubating now.
Otherwise, Neil would have been writing you $1 million check right now.
I'm sure.
Yeah,
Thank you so much, Neil. I'll hold you to that later.
All right. I shouldn't joke around like that because then he'll be like, hey, boss, where's the money?
I need a raise.
Yeah, exactly.
Cover that $1 million check you just wrote for me.
Great.
Just saying.
So glad we had this conversation, guys.
Right.
I'm glad too, Chelsea. I mean, I appreciate that.
Look at what Pradya says. Philanthropy matters. Absolutely right. Philanthropy does matter. And thank you for telling us about that book link. I mean, that issue link. From Catalyst, the New England Journal of Medicine. And we also want to, I noticed that you're on LinkedIn, the organization, and you're deliberately not on these other platforms, or what's that story?
I've hung back from the other platforms or kept them personal. I was very publicly involved in the public eye during COVID-19 and during the response. And for the privacy of myself and my family, I pulled back from public social media. So I'm wading back in, but for right now, LinkedIn is my public sphere.
But the coalition itself is only on LinkedIn. That's the only thing I saw on the site.
Oh, the coalition. So I thought you were asking about myself. We could dive into that. The coalition is currently only on LinkedIn. We're just starting to bridge into social as we build out our infrastructure. And we found that LinkedIn was the place that we were catching most folks.
Excellent.
Yep.
And Debbie saying, have Kaiser inform all of their members of your work. I'm one in the Mid-Atlantic region. So so even though they're sponsoring you and supporting you, they may not have so many projects, right? So you have to do the work. That's why you're here and on a Sunday morning. So I'm having trouble with the way we usually read this, read the paper is that we, I have a phone camera on my phone. I look at the paper, but we're having issues. So I'm going to try to look as much as I can in this fashion. But if that doesn't work, Neil will pull up his camera phone and show us there. So let's just see what the headlines are. The Secret Service strains to keep president safe, and a story about Usha Vance in there. And in the West Bank, residents cling to livelihoods, cutting politics to sell movies to the masses. And Simone Biles, whose only judge is the Mirror, or the only one that she cares about. And lobbyists greet the Harris campaign. And so these are all stories on the front page. And I know because of your position as the head of a nonprofit, you have to be careful about what you say. So only jump in at any point where there might be a story you're interested in. Here is speaking of healthcare, sometimes we like looking at the ads also. So here it says, talent is best spotted early, so is cancer. And this is a picture of someone breaking. And that reminds me that the Olympics have breakdancing as a sport. And I hope that the winner will be somebody from, for the first time. So it'll be somebody from the Bronx or Brooklyn or somewhere in New York. But as happens with a lot of countries that invent a sport and then export it, then other countries do really well. That happened with in South Asia for the South Asian Games, where India has a native sport called kabaddi, and surprising countries do really well in that now. So that's what happens here. That's what could happen here, and I understand it has to be an international sport, obviously, to be performed at this. As a public health person, I think you would love to. I'd love to hear your thoughts on exercise and the value of just moving in order to be helpful for general pandemic. I mean, to have general public for the public.
No, I think absolutely. Just movement in general, moving your body, getting that 30 minutes a day in, but also ensuring that our policies and our systems encourage movement, right? Does your workplace offer standing desks? How do we get out of our seats in our offices now that we're all returning? And how do we get better bike paths and walking lanes and encourage pedestrianism throughout the country? Oh, we're getting into weather. You heard me say weather before.
Yes. Floods change farming in Vermont.
Yes.
And climate change is part of the public health crisis that we're all going to experience. By the way, this is my cue to remind Neil to stand up and stretch, because last week, yesterday at the South Asian Men for Harris event, he's standing, or he stood for a second. Neil, that's why you need to get an Apple Watch, because it forces you to stand for 1 minute. You can't just stand up. You have to stand for a minute. I'm just watching him behind the scenes. I can see here. But for 3 hours, more than 3 hours, he sat and didn't get up. And
oh, no, Neil.
Yeah, we worry about that. Are you a space gal?
Oh, huge space nerd. Weather, space, pretty much anything in that realm. Huge space nerd.
Look at this headline. Signs of life on Mars? Not quite. Rock shows signs of life. So that's teasing. And then at a fake campus protest, real frustrations simmer. This is about a scene at Queens College. I don't know why they call it a fake protest. Yeah. And here is more stuff about JD Vance. Look at this. This is where, and this is not, I'm not saying this to you so that you don't have to worry about it. But here is a story you can see buried on page 15 of the New York Times, a small box here. Trump tells Christians, vote just this one time. Basically, he said that, don't worry, Christians, if we win this time, you won't have to vote again after 4 years. Just think about that. That should be the top headline here. But it is buried here because Trump says so many ridiculous things. But one of the things we learned from Maya Angelou, when they tell you who they are, believe them. Why do we not believe them? Because in part the New York Times and other places play down the worst stuff, and that's where we are. So it's really, really problematic, and lots of conversations about who will be the next vice presidential nominee for Kamala Harris. So lots of speculation there. Yeah. One of the things that I saw that was surprising to me is that Josh Shapiro, whereas Kamala Harris's dislike numbers are 49, something like that. Trump is like 45, 50, 50 plus, right? So there's that. But in Josh Harris's case, it's positive 62 and negative 30 something, which is unusual for any politician in this decade. And so, or in many decades, that hasn't happened. Those kinds of numbers haven't happened. Remind everyone that 100 days is a long way to go. It's actually more than the Indian, the British, and the French elections combined. Wow. That from the time she was nominated or announced. In theory and in the movies, yes, you can diffuse a tornado, but not in real life. So this is a story just for you, Chelsea.
Yes.
I hope you will find that picture. Yes. And then Ronald Dumas 101 years old, French foreign minister tainted by scandal dies. And Daryl Daniel, illustrator of Snoop Dogg's first album. We were talking about hip hop earlier.
Yeah.
He died. Oh, that's a very famous hip hop record cover, which is not quite visible there. It's called Doggy Style for Snoop Dogg. And let's see.
I have to say, Snoop Dogg has really been making quite the appearance at the Olympics. I know we'll get to the Olympics, but when you have a chance to catch up, it's been quite a show.
Why? Yeah. What's he doing there? Is he on the air, or is he just?
He's there representing America, carrying the torch. He
carried the torch.
Oh yeah, he's having a ball.
Why?
He's Snoop Dogg.
He was one of the torchbearers. Sri, they gave him, and I think is he also doing commentary, Chelsea? And
yes, he's doing commentaries. He's going to all the events. He's having the time of his life. Clearly.
Yeah. Are you a hip hop head by any chance?
I'm not. I can't claim to be, but I enjoy hip hop.
Okay, good. Jerry Miller, 81, lauded guitarist with the band Moby Grape, is dead. And Kathy Willen, 74, trailblazing photojournalist who seemed to be everywhere. And I'm glad to see not her passing, but her being recognized with some really dynamic pictures. I said that looks like a little bit like George H.W. Bush, and it is. And reminds me of the topless photos of Mr. Putin. And there's Billie Jean King. And then here, people walking past the ruins of the Culmer section of Miami after a riot in 1980. So trailblazing photojournalist Kathy Willens has passed. And let's see here. We did mention the Olympics, so we'll quickly look at that. Ralph Lauren, that designs the uniforms, has an ad in the paper. And look at this. I don't know what everyone's a critic when it comes to the uniform selections whenever they're unveiled. And then on the beach beneath the Eiffel Tower, they're doing a lot of stuff outdoors.
They are.
And I believe I didn't see it, but the opening ceremonies were on the Seine outdoors on the banks of the river in one place, which is fantastic.
Yeah, it was brilliant.
The decathlete who picked up a gun, Ukrainian soldier, among hundreds of athletes killed in war with Russia. He dreamed of representing Ukraine in the Olympics. We're very, very sad, to see that. And there is a story here about Neeraj Chopra, who won the javelin gold medal and has fueled India's dreams of hosting the games. India wants to host the games in 2036. It's still not decided yet. And I think given the size of its market and population and the advances it has made, there will be a big push for India to get it. It says, Jonathan says, it seems every Olympics Ralph Lauren gets criticized.
Yeah.
And Pradnya says lots of drama around India's uniforms. I did not know that. And Ellen says, too many people don't believe Trump. They should. He's dangerous for us all. Mary says, remember the debate was just 1 month ago and everything from a shooting to a change in candidates and a convention has happened. Yes, 100 days is an eternity and anything can happen. Jonathan says, every half hour or so I walk around my apartment. Neil, take a lesson from that. And Miriam says, as soon as I heard you mention movement, I got up and picked up a pair of dumbbells. Yay.
Amazing.
You're doing public health one person at a time here.
Love it. I'll take it.
Yeah. This is
Well, breaking news from a friend who's keeping me posted on the Olympics right now, if anyone's interested. So the US
one second. They should also close their ears if they want to watch it live.
Sorry, I don't want to be a spoiler. Okay.
Yeah, so spoiler alert, everybody mute for 10 seconds. I will tell you when to come back. So go ahead.
Okay.
You speak and they'll come back.
Oh, okay. Sorry. So spoiler alert, the U.S. just took silver in women's mountain biking. Haley Batten. So it's very exciting for those who are Olympics heads out there. That just happened. So thank you, Parekh in Nashville, for giving us the live updates.
Hey, Parekh, you want to be our Olympics reporter? We could do that. Arun, watching from Canada, great friend of mine from Sri Lanka. Although I see your notification on Facebook, I don't watch every show. However, I must say, Sri, I'm amazed by your team's consistency in producing these shows almost every week for the past few years. Hats off to you and your team. Thank you, Arun. It means a lot. We've been doing this for 8 plus years. We started this, Chelsea, because I wanted to figure out Facebook Live, but it also became our love for newspapers, fighting misinformation, disinformation. And it's not just the New York Times. As you saw, I criticize the Times when it needs criticizing. And we've done this with the Washington Post, the Chicago Daily, the Daily News, Chicago Sun-Times, the Toronto Globe and Mail, Khaleej Times in Dubai. So we love just talking about news.
I love it.
Leisure, name your favorite show or movie that you
that's a hard one. I mean, all-time favorite show, Parks and Rec, easy.
You can always get into it. The same, I believe, the same executive producer or same creators created The Office and Parks and Rec, or 30 Rock and Parks and Rec.
30 Rock, I think.
Oh yeah, it's amazing. And then rap act that boomed all by itself. Suicide Boys gets little help to attract a giant following. I don't know them at all. And letting his imagination run wild is the story of Keanu Reeves co-wrote a novel that's far from ordinary.
Oh yeah.
Where does he have the time? He's amazing.
He's figured out time travel.
There you go. Especially for his looks, right? He just stays the same. Grief in bright colors on her terms. Helen Martin's new paintings at the Gagosian show her working through the loss of her husband, the artist Bryce Martin, in mixed media. Really interesting.
I love that. I turned to art during the pandemic for myself and really did a lot of illustration and writing. So can speak to how much that heals.
Well, thank you for sharing that. Just what is the matter with Madden is the video game series scored an exclusive NFL license 20 years ago. Today, its ratings are dismal. I had no idea that there was a crisis in Madden land. Are you a football watcher?
Football watcher, definitely not a not a gamer. Yeah,
but a watcher. So, who's your team, and what's the season going to look like for that team?
I followed a couple of teams when I was studying abroad in Mexico and Brazil, but I think ultimately my heart lies in Chelsea because of friends in the UK, and the name obviously.
So isn't this interesting? Isn't this interesting? I meant American football, and you meant football.
That's funny.
That's really good. No, good for you. I think that's really
American
cool.
Football. Not so much. Not for me.
There was some stupid WhatsApp thing of a video that was said where a guy says his wife accused him of not being American enough, and he says, "I saw that a kilometer away." And so that's what we're living a TikTok meme here. Blooming where you're planted. It's the real estate section. Lovely picture here. Are you a gardener? You're a water.
No, I have a black thumb. You don't want me anywhere near a plant that isn't made of plastic.
Oh, okay, good.
My husband is a huge gardener. I am allowed to touch our compost because that's already dead.
Oh my God. Okay.
Yeah.
Okay. Fashion guardians share their secrets, and older craftsmen retire, apprentices are learning the skills to work with leather and textiles. Oh my God, that's some
cool skin.
I don't know what some skin.
Yep.
Yeah. Amid rubble and trash, a vision of a park. Rosa Chang has been working to turn 9 ugly acres under the Brooklyn Bridge into the High Line. So,
yeah, I've been reading about that. Yeah. I love the transformation of space into public space for public utility, to our conversation about physical access, but also just environment, getting more trees, better for the air. Love it.
And the Sunday opinion is, Kamala Harris win over you and you and you and you and you and you and you. And this is an interesting collage of her in all her pants.
Yeah, that's fun.
Many colors. And let's see, the Sunday Styles cover is
Brad.
What is that? Oh, you can't escape this color. This is about. This is not millennial pink. The energy behind this, it is alive. And I've not watched any of the stuff about Brat or this color, so I don't know what's going on. But I do want to challenge you with the social cues column. This is a unscripted part of the show. Everything's unscripted.
Great.
But this is where I look at the Philip Galland's etiquette column in the style section.
Excellent.
And let's see here. So I'll read the question from the audience, and then we'll hear your answer. There's no right or wrong answer, and then we'll read his answer. Okay. A double date disaster. I made a new friend whom I met for coffee. She suggested we have a dinner with our husbands as a foursome. It was a disaster. Her husband talked about himself nonstop and never asked us anything about ourselves. My husband and I don't want to socialize with him again, but my friend keeps asking when the four of us can get together. I make up excuses, but she won't take the hint.
Yeah.
How do I let her know that we want to see them? We don't want to see them as a couple without losing her friendship. As you think of the answer, I will tell folks that there is a Seinfeld about this, because there's a Seinfeld about everything. And George and Jerry go on a double date, and George asks, did she like us? And he says, yeah. And he doesn't believe it. So he keeps digging and digging. And he says, yeah, she doesn't like you. Well, how did she say she doesn't like me? She said, I don't like him. And so that was direct answer. So what is your answer to this? What can she do to save her friendship?
I think probably just move to another country. No, I'm just kidding. So I think that the best policy is always honesty. I think going into something like this, though, you have to accept that being honest with your friend, and gentle but honest, might sacrifice the friendship. If this is what that person wants for the friendship and you can't meet them where they are, they might not be willing to continue the friendship if you're not willing to do like the foursome situation. So I think, or the double date, I think the answer is to be honest and frank, because excuse making only gets you so far, and you're just going to end up in a tangle of lies.
Thank you, Dr. Chelsea. All right.
You're welcome.
Here's what Philip Galland says. Don't put your friend in a position to guess. How can she possibly know that the excuses you're inventing aren't real?
There you go.
The situation is not uncommon. Just because two people get along doesn't mean they and their spouses will mesh as a group. Say, the double dates don't work for us. Or if your husband agrees, it may be easier to say the double dates don't work for my husband.
Mm-hmm.
Then continue, but I'd like to see you one-on-one. How's next week? She may feel stung, but better to be honest than to make up excuses forever. Oh my God, you got it word for word almost.
There we go.
Well done. Philip, she's coming for you.
That's right.
Philip Galland. That reminds me, we got to get Philip on our show.
That would be fun.
And the business section is Madam X. In trying to turn around the social media platform formerly known as Twitter, Linda Yaccarino faces one big obstacle. Her boss, Elon Musk. The company has lost billions of dollars in value, but also in actual revenue that's coming in. Something like it went from $620 million to $120 million. Some number like that was just crazy. And when women's safety comes down to an algorithm, we talk about public health. We have to also talk about the tech crisis. Mm-hmm. And
Absolutely.
Algorithms are a big, big problem. Last two things, and then we're going to start wrapping up. We only have 10 minutes left with Chelsea Cipriano, folks. Cipriano, not Cipriano. I'm trying to figure out what this is. The Olympics issue, breaking in. No disrespect to Olympic tradition, but look closely at athletes from the newest sports, and you'll see the game's true spirit. Wow, what a cover. Photographs by Philip Montgomery, text by Sam Anderson. And it's all about breakdancing being in there. It's called Breaking. And the book review cover, A Bouquet of Ideas. In the Garden Against Time, Olivia Lane makes an impassioned case for the garden as a repository of natural beauty, as democratic ideal and writerly inspiration. A.O. Scott's review, we already heard you don't have a green thumb, but what's a book you recently read that you would recommend? Recent-ish?
Yeah, right now I'm reading I like to read like 4 or 5 books at a time, because that's how my brain works. So I like to read at least one nonfiction and one fiction at a time. Nonfiction, I'm reading a trashy, but so good, I don't mean trashy, romance novel called The Ex-Hex. But then on the nonfiction side, I'm reading The Heat Will Kill You First, which is a real downer, particularly in the dead of summer, but it is about heat and its impact on human health and the environment and what is to come if we don't do something about it.
One of our clients runs the Global Heat Resilience Service.
Oh, really?
Talks about how bad, do you remember the 2023 summer in Europe was a disaster?
Yep.
They're saying by 2026, we'll look back and say, gee, that was a nice summer. about 2023. And Miriam points out, who knows how global warming will affect the world in 2036 when India is competing for the Olympics, to host the Olympics.
In 2023, I live in Northwest New York, or living in Northwest Louisiana now, and we were without power for 10 days last summer, in the dead of this summer. And we just saw this again in Houston, right? Our friends in Houston didn't have power.
I was going to go teach my AI workshop at a nonprofit newspaper there and news site. And I didn't go because of this. We're rescheduling for August. So if you're in Houston, say hi to me around August 14th or so. We'll be there. And Jonathan says I need to start thinking about a 10th anniversary. So we have a couple of years. And Miriam says today's the final day of the Met Museum's Harlem Renaissance and European Modernism.
So it's fantastic.
Friday, and it's wonderful. If you're in New York City, it'll be jammed, but try to go. And some of you know that I worked at the Met for 3 wonderful years. I enjoyed every minute of it. And I encourage everyone to see not just that show and not just at the Met. Go to a museum as much as you can. We used to say that our competition isn't the Louvre or Guggenheim or anything else. We say our competition is life in 2022, life in 2024. It's a competition is Netflix, Candy Crush. Those are the things competing for museums, not other museums. So we are almost done, and here's what we'd like to do. We're going to give Chelsea a moment to catch her breath and to come back with a final pitch on behalf of her organization, the Common Health Coalition, and why we should all understand what it is and why we should all be telling our friends who are in the healthcare business to sign up on the website. If they represent an institution, they should sign up at the Common Health Coalition as we get ready for the next pandemic. And so we'll give her a moment to come back, and Neil and I are going to chit-chat for a moment and then bring Chelsea back. Thank you, Chelsea, and thank you, Neil. Another great show, and we're so grateful to our friend Diane Stefani for bringing us Chelsea as a guest. She's brought us other great guests in the past, and we're booking now, I think, into October for guests.
Yeah.
So everyone, please,
I'll point out our 10th anniversary will be next year, Sri, 2025.
Oh my
which
God!
Is kind of crazy. So it's maybe not too early to start planning.
Exactly.
We've been doing this. You've been doing this for 8.5 years. I joined you 6.5 years ago. So we'll be hitting 9 years this October.
Amazing. I can't believe it. But here we are. Thank you, everybody, for watching. Here's what we want to tell you. A reminder that this show is sponsored by Muck Rack. We're very grateful to our friends there. And please sign up if you'd like to be a sponsor of our show. We would love to have you, or a sponsor of my newsletter, srinet.substack.com. And this is all brought to you by Digimentors, our company that does shows like this. If you'd like your own podcast, let us know. We also do digital marketing, comms, PR, training, and workshops. AI, my non-scary guide to AI, would love to bring it to you in person or on Zoom. In the last year and 2 months, we've been in 12 countries, and we will continue to talk about how to understand AI. We also do help you with AI policy, strategy, scenario planning, all that good stuff, scary stuff in some cases. And then we also want to remind you about Neil's shows. We have a show coming up, episode 12, Reverend Tyler Coles. Getting help takes a lot of work and some courage. This is the episode for Shining Light on Shadows, a candid conversation about mental health that Neil hosts usually every other week with Don Helmrich they do host this on all their social channels, and it's produced by Digimentors. So thank you, Neil, for talking about these very important issues. And next Sunday, August 4th, Manisha Sinha is with us. She's on Twitter at Professor M. Sinha. She's a historian and author of The Rise and Fall of the Second American Republic, Reconstruction, 1860 to 1920. She's an amazing expert on American history, but also what it means in today's world. A lot of the things we're seeing today, Neil, as we know, are things that already have been foretold in American history. And I will be traveling to Germany to do my workshops, so you will be in the driver's seat. And thank you for stepping in whenever I am traveling. And so, folks, please check us out on Digimentors.group. A reminder to go get right now the New York Times Kids section, the PDF for free.
Sunken Treasures is Sunken Treasures. If you look at the centerfold,
Sunken Treasures
if you open to the center of the paper, it's actually gorgeous in there.
Look at this.
And you can download it from our website until noon today.
Digimentors.group, and look for the
Chelsea
New York Times read-along and Chelsea's episode until noon Eastern. You'll have it there. World exclusive, brought to you by Amber Williams, Wayne Camadoy, and Tom Jolly of the New York Times. I think we're ready to bring Chelsea back.
And before we do, I just want to actually go back to last week's episode, Sri, with Julie Shelfo, founder of Mothers Against Media Addiction. Want to make sure if people missed it, we watched that episode together as a family, me, Pam, and Emily,
11.
and reviewed some of the comments that she made specifically around social media use, cell phone use for kids. It was very profound. It was very helpful, and it's going to inform our decision making going forward in terms of how Emily uses devices. So wanted to just do a plug for that as well.
Thank you. And now let's bring Chelsea back. Thank you, Chelsea, for being here. Thank you for spending your Sunday morning with us in your isolation. That sounds very intriguing.
Yeah, it's very nice.
It has a roof, though, or no roof? No roof.
Yeah, it has a roof. It's like a box.
It really is a box? I thought it was just like a divider. So you bought a box.
No, I'm at a working space right now. This is not in my home.
Okay, got it. I thought
like a soundproof. It's like a little booth.
Yeah, it's a booth. Right? Yeah, but this is not in my home. That's another. Okay. I'll have the discussion with my husband later.
Well, please say hello to him, and we are grateful to your service in public health, his service as an emergency room doctor. We lived next to an emergency room doctor for the first 18 years of our kids' lives, and we were blessed because he was able to do a lot of.
They make good neighbors
at home.
Yep, they make good neighbors.
But one of the things he said is that he loves the work because there's no homework. Right, the patients sadly either don't make it, or they make it and then they go on, or they go for further treatment somewhere else. But he pointed out that at universities and at hospitals, the fundraising is very hard because nobody remembers your ED doctor. They remember their cancer or their heart surgeon and things like that. So they don't have wings named after or donated by ER patients the way they have for other things. But ER doctors, nurses are unsung heroes of hospitals. So thank you to him. And now we'll put you full screen so you can talk about the Common Health Coalition.
Amazing. Thank you so much. And I just want to, number one, thank you both for having me. This has been really an amazing experience and so fun to start a Sunday morning off like this. I think, Sri, you were saying just learning from history is something that we as a nation should do more often. And I think that when we look at COVID-19 at the acute phase, right, of the COVID-19 pandemic, all of the loss, as I said, of life and also of livelihood, we need to not just learn from it. We need to mobilize those lessons learned. And so that's what we're doing as the Common Health Coalition. We're taking a never again approach, saying this can't happen again. How do we prevent this using the lessons learned? And so we are working across healthcare and public health to envision a new health system, one in which the two fields really are working hand in hand, not in parallel. And we're working to improve the health system that we have through strengthening these partnerships by amplifying and really shining a spotlight on the creativity and innovation happening across the country day in and day out that may be happening in the background, but saving lives in the foreground. So doing this will prepare for the health crises of tomorrow, but also those that everyone is facing today, whether you're a clinician or a community member, our moms, dads, grandparents, kids. And the only way to do it is together. So for those listening, if you lead an org or have a friend in an organization in healthcare or public health, we'd love for those organizations to sign on to join the coalition. It's free, Common Health Coalition. NYTReadalong.org. And you can also get in contact with us through that form as well. So I'll end there, but thank you so much again for having me. And I look forward to the work to come.
Amazing. Thank you so much. We salute you for your work and what you're doing. Building coalitions is not easy. And especially in the healthcare business, I'll remind our non-American friends that 3-4 of the biggest names in America tried to get together to fix the healthcare system. Jamie Dimon of Chase, Warren Buffett of Warren Buffett fame, and Jeff Bezos of Amazon got together along with Atul Gawande, the New Yorker writer and doctor, and they failed and put in millions of dollars. It all evaporated. It tells you how hard and how complicated this is. Final stat for today: America has 5% of the world's population, had 20+% of the world's COVID deaths, in part because the system wasn't ready, in part because of poor leadership at every level, starting at the very top of the United States, because of misinformation, disinformation, and the next pandemic with AI will be much, much worse. And that's why we need Chelsea and her colleagues to be fighting for us and to be ready for the new time when this happens. Thank you very much for joining us. Thank you for watching wherever you are. We do this Sundays, 8:30 a.m. Eastern Time. Our next episode is with Professor Manish Sinha, historian and expert on the past sins of America and the current and future sins. We'll see you again, folks. Thank you very much.
Bye-bye.
Bye.